My name is Dr. Khan Kao. I am an emergency physician. I'm doing a series of interviewing doctors in hope of giving medical students and pre-med students to learn about each specialty. And today we're joined by Dr. Greg Kadian. He is a pediatrician. Welcome, Greg.
Thanks. Happy to be here.
Thank you for your time. I know you're a busy guy, so I appreciate it. So,
yeah, absolutely.
All right. So, Greg, how long have you been practicing as a pediatrician? And can you briefly tell us a little bit about your job as a pediatrician?
Sure. So I've been a pediatrician for about 5 years now. I work in a general pediatric practice here in Cincinnati, Ohio. So my job entails primary care. So I see kids from ages 0 to 22. We manage all kinds of medical problems. We do well checks. We give vaccines. I do some minor procedures in the office. So it's a pretty diverse set of practices.
Cool. Thanks for that. A lot of us, including myself, did not have a clue of what specialty as a medical student. So how did you end up choosing pediatrics as your specialty? And did you have other options as well that you were considering?
Yeah, that's a great question. So I kind of went about it via a circuitous route. Going into med school, didn't really know what I wanted to do. And, by second year, I really thought I was going to be a surgeon. I really enjoyed, working with my hands and doing procedures, things like that. So through my second and third year, I did a lot of rotations in surgery, general and orthopedic, and was kind of settled on orthopedic surgery before finally during my fourth year, realized that ultimately the lifestyle, both through residency and after residency, wasn't quite what I wanted. I had done my pediatrics rotation last during my third year and really enjoyed that rotation. So after a lot of soul searching, my fourth year, I finally made the decision that pediatrics was probably the right fit for me.
All right, thank you for that. I know it was a long road.
Yeah, it was.
I know you're happy doing what you do. So what kind of characteristics and qualities make for a successful pediatrician?
Patience, definitely. So, I think obviously in general in medicine, we all have a need to help people, a need to, fix problems. We want to make people feel better, but pediatrics especially, there's some sense of making a kid, feel better, fixing that boo-boo, making them kind of enjoy their life a little bit more. I think patience, when I say that, I mean, kids are tough in that they don't tell you exactly what's going on. You have to read a lot of secondary clues. You have to take information from parents as much as from the kid himself, and realize that the answers aren't always going to come right away. Plus the fact that you have a patient that doesn't always want to be in the office, doesn't want to be examined, doesn't want shots, so you have to be, patient with them and realize that, eventually you're going to get there. I also think just a general curiosity for medicine is a good case. And that's true for a lot of specialties, but, in pediatrics, I find that we really get to use our exam and history skills probably to more extent than any other specialty. I tend to, rely more on those skills rather than labs or tests or things like that. So I think people who, really, want to use those medical skills that they're learning in school, more than just relying on tests and procedures and things like that.
Yeah, for sure. What is the typical training path to become a pediatrician?
Yeah. So obviously, after 4 years of med school, then you're going to do a residency. Pediatric residency is typically 3 years long.
Mhm.
Some people will go on to do a chief year in pediatrics, which will be an extra year. So it's not required by any stretch of the imagination. And the chief year is mostly an administrative role. So the chief residents of the program typically manage the residents. They do schedules.
Mhm.
They do a lot of teaching. So if you're interested in that aspect, like if someday you want to be, the dean of a med school, or you want to run a residency program, then it's a good thing to do a chief year, but it's by no means necessary for moving on in the career. So then after 3 years of residency, you have a choice. Either you can go into general pediatrics, either through hospital medicine. So, there's pediatric hospitalists who just do, rounds. They manage patients inpatient. You can be an outpatient primary care doctor like I do. And then some people get a mix of both. So depending on what part of the country you live in, rural versus urban. There's lots of different opportunities for mixing inpatient and outpatient medicine. Um, so that's general pediatrics. And then if you choose to do a specialty, you can do that and can go on and do a fellowship, which can range from 1 to 3 years in many different areas in medicine.
Cool, cool. You touched upon like the difference in setting outpatient. Can you describe to the medical students and me, myself as well, uh, differences in practicing, like practice patterns or lifestyle and those settings?
Yeah, absolutely. So, outpatient medicine is going to be your typical kind of 9 to 5 job. Often we do have some extra hours. Some practices will go till 6 or 7 at night, certain days of the week.
Hmm.
Most practices will have some kind of weekend hours. Like my practice, we work from 8:30 to noon on Saturdays at one of our locations. So if you're going to be in the outpatient setting, expect 9 to 5 plus probably a few extra hours a week of outside the normal hours, because that really helps families out who can't get to the office during business hours because they're working as well. Um, so in addition to that, there's usually a call scheduled. My call is phone calls, so I field phone calls from concerned parents any time of the night, and usually I do that about once a week, and then one weekend a month I'm on call. So that does add a little bit of extra work outside of the normal business hours. For inpatient, that's really varies on what you do or where you're at. Most of the time it's going to be kind of like a shift work. So
Hmm.
you'll be on days and you'll work from 8 in the morning until 6 o'clock at night, and you'll do that 5 or 6 days in a row, and then you might have 5 or 6 days off, and then you might do a week of nights where you're the hospitalist on call, in the hospital overnight. And so it really depends on, if you're a small or large institution. If you're a pediatrician doing hospital medicine in a rural area and you're the only pediatrician you know, at that hospital, then you might be on call every other day, but your volume might be a lot less. So that's definitely something to think about, what you want your lifestyle to look like in terms of ultimately what you pick.
Gotcha. So what do you find the most exciting or like the most uh, in pediatrics?
Yeah. Uh, Probably the things that I enjoy the most, one, are relationships with families. So,
Mhm.
kids, you get to meet them when they're born, and then you get to know them as they grow. It's kind of like having your own kids to some degree, but you don't have to do all the work with them. You just get to see them every few months or every year as they get older. So you get to see them grow up. You get to see all the awesome things that they're doing, uh, and you develop really good relationships with families. They become your friends in addition to just your patients. So I really enjoy that aspect of the primary care pediatrics. You know, in addition, I think probably one of the most rewarding things with kids is they tend to get better really fast. They can go downhill quickly, but they get better pretty quickly. And so, it's really nice when you get a kid who's sick and you make an accurate diagnosis and you apply the right treatment or the right procedure. And then, within a few days, they're doing much better and family's happy, the patient's happy, and you get a lot of secondary gain from that. So it's probably the most rewarding thing.
Cool, cool. And then on the other end of the spectrum, what do you dislike or like least?
Yeah, well, probably like all doctors, I hate charting. So that's probably my least favorite part of the job. I don't really enjoy the administrative side. My practice is small. We have four MDs and one nurse practitioner. We do most of the administrative stuff all ourselves between the doctors and then an office manager. So, dealing with those kind of things isn't always the most fun, but it's necessary. Dealing with patient care, I'd say probably the most difficult thing is just, I'll say, difficult parents. So in medicine, in internal medicine, adults, you really only have to deal with one person, just the patient themselves for the most part. But in pediatrics, you're dealing with patient, mom, and dad. And sometimes it goes great and they're happy and everything's good. And sometimes things aren't going so well and you have frustrated parents who don't know why something's wrong with their child, or they have a weird diagnosis that you haven't figured out yet. You end up investing a lot of time, in not just working with the patient and trying to figure out what's going on, but a lot of time, talking with the family and trying to explain. And, the good news is once you've built those relationships, over many months and many years, then it becomes a lot easier to do that with families because they do know you and they know that you've got their best interests at heart. But yeah, those things can be frustrating in medicine.
Yeah, I bet. You've touched upon work-life balance. Can you describe to us, as a pediatrician, how has it affected your work-life balance, and discuss how you've discussed the work hours, so that's great. And, so just go into a little detail. Were you able to get to do your outside activities as you wanted?
Yeah. So one of the things that drew me to primary care was work-life balance. It is a very, a very optimal setting for the outside interests and doing things. I work 4 total days a week. So I do 3 full days, 2 half days, which I like because I'm in the office every day that I can see patients, but I have 2 half days to myself to do whatever I want. And then I said I usually work 1 Saturday morning a month. And really the rest of the time is mine. I go home, I can explore other interests. I like to do woodworking. I like to go to the gym. I have 2 children that, we like to do activities all the time. So, I found that being in primary care pediatrics really allows me to have those outside interests and explore those. Probably the more challenging aspect of it is time off, travel. You really have to plan ahead. So there's not a lot of spontaneous, I feel like going on vacation next week because I'm off for 7 days. It doesn't really, we don't really have that. We have to plan our vacations, at least 2-3 months in advance. So, if spontaneity is important to you, primary care is probably not the best field for you. You're probably better doing kind of like what you do, Con. You've got a shift, when you're working, when you're not.
Yeah.
You've got weeks off here and there, and you can go wherever you want. Yeah. Primary care, you really got to be available. You got to be around. But I still get plenty of vacation time. I usually have 4 weeks a year. I just have to plan it out a little bit better.
Yeah, you just have to plan it ahead of time. So
exactly.
So how has your specialty changed over the years, and then more recently in light of COVID-19 as well?
Yeah, I think, just in general, primary care has gotten probably a little narrower. I mean, I would say, 30 years ago, 40 years ago, pediatricians did a ton of stuff. You manage the baby not only from, not only in the office from birth, but you manage the patient in the hospital. As soon as the baby was born, if you had a baby that wasn't doing so well and needed to go to a special care nursery, you were still managing that patient. And even in the NICU, potentially in the early days, you would see, patients in the hospital in addition to your office. So that's definitely narrowed to some degree. There are some opportunities for that, especially if you're more in a rural setting where there's not a lot of pediatricians or specialists around. So you'll probably do a lot more of that. In my practice, we actually do still round on our babies in the hospital when they're born, but if they need any higher level care, a special care nursery or NICU, then they're seen by a specialist. We also, we're fortunate in Cincinnati, have one of the best children's hospitals around, Cincinnati Children's,
Mhm.
and they do a great job of managing our patients in the hospital, but we do kind of miss out on that opportunity to continue to see our patients in the hospital. So the scope of primary care is definitely narrowed, but I find that there's a lot of opportunity, you know, um, to expand your practice to what you're interested in. So if you like doing procedures, if you want to do suturing and abscesses, you can carve out a niche for that. So it can kind of be what you make of it, and there's opportunities to do moonlighting in certain specialties, like moonlighting as a inpatient doctor. You can moonlight doing newborn rounds. You can moonlight in urgent cares and ERs if that's interesting.
Mhm.
So there's some opportunities to carve out a little bit bigger of a practice if you're interested in that.
Gotcha. Thanks for that. So, what changes do you see coming in pediatrics in 10 to 20 years down the road?
Yeah, so probably one of the or two of the bigger things. One is going to be telehealth. I mean, we've certainly seen that. You mentioned COVID, and I didn't touch on that, but certainly telehealth is a big aspect of medicine that's coming. And as technology improves,
Mhm.
certainly just the use of Zoom or Skype,
Yeah.
has allowed us to do a lot more than we could 20 years ago. And so, in my practice alone, we had talked about telehealth before, but never really acted on it until COVID, like many practices did,
Mhm.
and it kind of spurred us on to try out a few different services and see what worked, and that's really allowed us to expand our practice, like mental health services, doing those just over the internet. So also, I think going forward in the next 20 years, we're going to see a lot more mid-level providers providing care. So nurse practitioners, PAs, which I think for primary care is necessary because it's a field that continues to expand. And unfortunately, the pace of MDs going into primary care is not really caught up with that.
Yeah. Yeah. You touched about, you mean working with NPs and PAs as well. Do you see the responsibilities of them changing down the road in 10 or 15 years?
Yeah, very, very well could be. I think there'll always be some supervision, with an MD present, but I
Mhm.
think we're going to see more and more NPs, acting pretty much as primary care physicians for a lot of patients, especially as the population grows. So, I think I mean, we've seen it already, especially inpatient, with a lot of nurse practitioners, um, taking over roles that traditionally residents would handle, or other physicians would handle. And now, as we move outpatient, uh, they continue to expand, which it's tough because it's a I would say outpatient medicine is harder to do for nurse practitioners because the scope of your practice is so big. It's one thing to kind of learn a very small, niche in the hospital, like, being a nurse practitioner on the pulmonary floor who works with vented patients,
Mhm.
versus in primary care, you have to know the whole gamut. You have to know a little bit about everything in pediatrics. And that's difficult doing even just coming out of a 3-year residency. But for a nurse practitioner just coming straight out of school, it's a big learning process. It's certainly achievable, and like I said, we have a nurse practitioner at our practice that we hired about 6 months ago, was family practice nurse practitioner, was pretty much more or less fresh out of school, had done a couple of years in adult medicine, but not really pediatrics. So for a lot of it, we've had to go from square one and really build up the knowledge base. So it's going to take a few years to really get there. But I think as a lot of NPs or programs are they continue to grow and expand, I think they'll have a big focus on primary care and trying to get people ready for that.
Yeah. So with in light of everything, telemedicine and P's and COVID and whatnot, what do you think the job market would be like when with the current medical students or students?
Yeah, I think the job market it's going to be solid for any MD that's coming out of residency. I don't think that's ever going to change, at least not in the next 20 years. Especially with primary care, because it is so necessary. I think maybe the subspecialty market may I don't want to say shrink, but may stagnate a little bit, because there are a lot of people going into subspecialties in any field, whether it's pediatrics or internal medicine. But so those opportunities may be a little bit less guaranteed. But in primary care, pretty much I think you're going to be guaranteed a job coming out of school. You may be working with NPs. Your job may be a lot of administration. It may be a lot of precepting mid-level providers, but the job will be there.
Cool. That's reassuring to know for medical students interested in pediatrician. So what's the one thing you wish you knew sooner that you know now?
I think going into primary care, I probably would have liked to know more about the business and administrative side of medicine. We don't really talk about it in med school. We get a few hints at it, and there's some different clubs or groups of some people who are interested in it, but I really never met anybody who was all that interested in actual business of medicine. But really going into primary care, it's a very real and very present focus of the practice is how do we keep the doors open, how do we market ourselves, how do we keep patients, how do we attract new patients. Things like dealing with landlords and maintenance, all those things that you don't really think about in med school, they very much come to light once you're out in practice, and many of them are interested, and I've taken an interest to it being in practice. But yeah, I think I would have liked to know a little bit more about, I guess, what I was getting myself into. Coming out of med school.
Yeah, I totally agree. I think even all the specialties, including emergency medicine, we don't get enough teaching of business and medicine. So I feel like it's one of the biggest weaknesses of getting us out there in the real world. But I guess you learn by trial by fire. Anyhow, you touched upon like other opportunities coming out of pediatric residency. You did a sports medicine fellowship. What are other opportunities you can do besides, being a pediatrician or in conjunction?
A lot of opportunities after a residency. So you mentioned fellowship, and pediatrics has dozens of fellowships, just like internal medicine, family medicine. So people go into cardiology, pediatric cardiology, gastroenterology. The market for those things is a little bit smaller, just because kids are not nearly as unhealthy as adults, but they obviously do get sick and they need care. If you're going into one of those subspecialties, you tend to be looking at academic centers, because in general, pediatric rheumatology and pediatric gastroenterology, pediatric cardiology, they don't really exist outside of academic centers. So most people who are going into those are interested in academic medicine, which usually involves a combination of inpatient care as well, outpatient care, inpatient care, and research. So that's, if you're interested in that combination, then usually a subspecialty might be good for you. But there's a couple other subspecialties that don't require as much of that. So you mentioned I did the sports medicine fellowship, which was nice. It was only a 1-year fellowship,
Mm-hmm.
and it really allows me to blend, primary care with the musculoskeletal management. So I do a lot of injuries, broken bones, sprains, strains, concussions, all those kinds of things in my own practice, and the fellowship really helped with that. Outside of just medicine, you can do masters of business administration. So some people do that if they're interested in going on and doing like administration of a hospital. Some people will do a master's in public health. So if you have an interest in, public health, politics, regulations of medicine, that's another option to do after residency to balance things out. So a lot of options.
Cool, thanks. So are there any other resources for those who are interested in pediatrics?
Yeah, probably your best bet is going to be the American Academy of Pediatrics website, so aap.org. That's got all kinds of great information from, stuff for parents. So the sort of parent-directed version of that is called Bright Futures. It talks all about development and things like that. But for professionals, there's a whole division of the website devoted to that. So you can go on there, and it has information for every level, from pre-med, med students, residents, potential fellows. So that's a good resource for looking at things and connecting with people.
Okay, cool. Thanks for that. And then lastly, what's your number one tip, or multiple if you have one, for students who want to go into pediatrics?
Yeah, I think just find some pediatricians and talk to them, shadow if that's an opportunity for you. If you've got an opportunity in med school to do a continuity clinic with a pediatrician. But yeah, just get out there and kind of see what they do, and see if that's something that you're really interested in. It's pediatrics is interesting. It's there's a lot of crying involved. You're going to spend a lot of your day listening to kids scream and cry, so make sure you can handle that.
Yeah.
If you don't like loud noises, then pediatrics is not your specialty.
Yeah.
But yeah, just get out there and meet some pediatricians, talk to them, and see what they do, and why they love their job. Not just my opinion, but why they love their job, and see if it's right for you.
Yeah. Definitely, those are great tips. And if you don't like loud, don't go into EMA as well. So,
definitely not.
So, anyhow, Greg, I appreciate giving your time to help educate the folks out there who wants to go into pediatrics or interested into it. So,
absolutely happy to be here.